everyone so much for joining Women on Wednesdays today. I'm Michelle Ehrenberg of Louisiana, and today our topic is reproductive health rights and justice during the pandemic. We have a great lineup of speakers today. I'm going to just pull up the agenda. Hopefully everybody can see it. We have Elizabeth Smith from the Center for Reproductive Rights, Stephanie Bingle from the New Orleans Abortion Fund, Pearl Ricks from ReJAC, or the Reproductive Justice Action Collective. We have Lakeisha Harris from Women with a Vision. We're going to be joined by State Representative Mandy Landry. And we also have Louisa Tanhauser from the Center for Reproductive Rights. So we have a pretty packed agenda today, and I'm very excited to have all of our partners, working in the movement here in Louisiana, joining us for this Women on Wednesdays. Just a little bit of housekeeping. I'm going to ask folks to please mute yourself unless you are talking or you have a question to ask. You can mute yourself either on your computer by selecting the little phone icon. You can also mute yourself on your phone by pressing *6, and *6 will also unmute you. The other thing is, if you have a question, you can feel free to ask it. We will try to reserve time at the end, so if you want to wait till the end, but if it's something that's really pressing, we want to make sure that people have a chance to get their questions answered. So you can ask it, or you can type it into the chat box, and we will have one of the speakers answer it for you. And we are recording this Women on Wednesdays, and we'll make the link to the recording available for folks. So if you have to jump off, then you won't have to necessarily miss everything. And we also will be following up by sharing some resources that folks will be talking about today. So with that, I am going to introduce our first speaker, Elizabeth Smith from the Center for Reproductive Rights. She is going to talk to us about how the COVID-19 pandemic is challenging access to abortion, even more so than I think all of us, understand it to be in Louisiana already. So I'm going to stop sharing my screen and turn it over to Elizabeth.
Thank you so much, Michelle. And good afternoon to all of you. I'm just gonna now start sharing my screen. Okay. So I'm going to talk a little bit about what's happening across the country, and then Louisiana specifically in terms of abortion access and COVID-19. So in response to the COVID-19 pandemic, state governments around the country, including Louisiana, are issuing a variety of orders that should be focused on containing the virus, protecting healthcare workers, and prioritizing the use of healthcare resources. The law of each state determines which state officials can issue or enforce orders. And depending on the state, those orders can be issued by state governors, attorneys general, or state health departments. And as we all know, while some state officials are working to ensure continued timely access to all essential healthcare, others are instead exploiting this crisis to advance a decades-old coordinated campaign to ban abortion and shut down clinics. And these attacks come despite consensus among leading medical organizations in the US and globally that abortion continues to be essential during the COVID-19 crisis and therefore should remain available. So looking at the types of orders that state governments are issuing, numerous state governments have issued orders directing hospitals and providers to postpone non-essential, elective, or non-emergency surgeries and procedures. Some states, like Washington, have affirmatively stated that abortion or reproductive health care is essential. States like Oregon have left that determination up to providers. Other states like Texas and Oklahoma have explicitly said that abortion is non-essential or elective. In response to states like Texas and Oklahoma exploiting the COVID-19 pandemic to effectively ban abortion, the American Medical Association issued a statement opposing these restrictions and asserted that decisions about which medical procedures are, quote, non-urgent should continue to be made by physicians and their patients and not by politicians. So in Louisiana, as I'm sure you all know, Governor Edwards issued an order directing providers to transition to telehealth and postpone in-person services that can be safely postponed, and then issued another order for providers to postpone all surgical procedures except those to treat an emergency medical condition. The Center for Reproductive Rights filed a lawsuit in mid-April to ensure that abortion care could continue, and we are currently in negotiations with the state. So I'm just going to run through some other types of orders so you get a picture nationally of what's happening. Some orders that states are issuing require facilities to monitor their staff in order to identify anyone who may be ill. In other states, there are orders that are easing restrictions on providers and potentially increasing capacity. And some examples of increased capacity include allowing retired providers to resume practice, allowing future providers who are still in training to provide care, allowing out-of-state providers to provide care without an in-state license, and allowing advanced practice clinicians like physician's assistants or nurse practitioners to provide additional services. However, these orders have not eased any of the burdens of TRAP laws, targeted regulation of abortion providers, that single out abortion providers for different treatment. So telemedicine orders, as in Louisiana, states are relaxing telehealth requirements and expanding access to telemedicine. But again, these orders do not suspend existing telemedicine bans on the provision of medication abortion. 18 states, including Louisiana, currently prohibit the use of telemedicine for medication abortion, requiring patients to visit the prescribing provider in person to obtain the pills. The other side of this coin, in terms of access to abortion, is the orders that affect individuals. So we have seen the vast majority of states restrict individual travel, which can affect individuals' access to care. However, these orders tend to broadly define categories of essential workers and services and do allow people to travel for healthcare. However, some states have been issuing out-of-state traveler quarantine orders. So I'm sure you're all aware that there are essentially checkpoints between Louisiana and Texas on the Texas side of the border, where people who are traveling into the state by road are being pulled over and required to provide information to the Texas Highway Patrol officers in terms of where their permanent address is and where they are traveling to in Texas. However, the Texas order and other orders do contain exceptions for people who are seeking essential services. We also have seen states issue orders requiring social distancing and prohibiting gatherings of more than 10 people. But again, the majority of those orders include exceptions for people seeking healthcare. And then finally, we can talk forever about lots of other things that are affecting abortion access, but healthcare coverage is another essential question in accessing abortion care. So for people who have lost job-based coverage, there are two options to potentially get new coverage. If you lose job-based coverage for an ACA plan, you can use a special enrollment period in the exchange run by the federal government to seek new health care. Potentially, the loss of job-based coverage can also make someone newly eligible for state Medicaid coverage. And then, I'm happy to be teeing up Stephanie Bingle, who I believe is the next speaker. We must really recognize the role of abortion funds in the question of coverage, because abortion funds across the country are currently helping individuals cover the cost of abortion care, and many are also helping with logistical and travel support in this time where all of these orders are affecting healthcare providers and affecting individuals. So I will stop there and stop sharing my screen.
Thank you so much, Elizabeth. I think we can probably move on to Stephanie, and if folks have any sort of urgent questions, you can type them in the chat box. Otherwise, we will try to reserve some time at the end for folks to have their questions answered. So I'm very pleased to have Stephanie Bingle, who's going to talk a little bit more about the work that the New Orleans Abortion Fund is doing and how abortion funds are responding more broadly to communities during this crisis.
Hey y'all, thanks so much for having, thank you Michelle for having me. It is so awesome to just look at this grid right now and see so many names that I know and so many folks that frankly that I miss seeing in person. So I'm glad that you're all here, and I really appreciate folks taking the time out of their day to join us in this like really special space. So as Michelle and Elizabeth mentioned, my name is Stephanie Bingle. I am the Executive Director of the New Orleans Abortion Fund. And I do not have slides, so you're just gonna have to look at my face or at the grid. But you know, I did my hair for y'all. So something that I think is, you know, in preparing for this conversation, something that kept coming up to me is that like kind of pain in the ass aphorism that you always hear about how all politics is local. And I think that that is important. Many of you have heard me shout quite a bit about how important I think state legislatures are and how important I think it is for us to be focusing our advocacy work at the state level. But when it comes to abortion access, and particularly when it comes to abortion access in this pandemic. Hey, Vivian, make sure you put yourself on mute, please. When it comes to abortion access in this moment, you know, while all politics is local, I think that it's important to contextualize that in the broader vision of how local politics have these regional and national implications. So as Elizabeth laid out, and as I think many of us know just by dint of living in this state, while Louisiana is doing one thing in regards to restricting or not restricting abortion access, what happens in Texas has impacts over what happens in Louisiana. What happens in Mississippi has an impact over what people in our state are able to access. What happens in Florida and in Alabama. I think it's really important to note, as Elizabeth did, that two of our neighboring states or close neighboring states, Florida and Texas, have state checkpoints looking for people from Louisiana leaving the state or people from their state leaving to come into Louisiana. And you know, in thinking about the way that abortion access has been impacted over the last basically 2 months now, I think it's impossible to talk about what's happening in Louisiana without also talking about what's happening in Texas. Even before this moment, you know, even a year ago, the New Orleans Abortion Fund was actively funding folks to go from Louisiana to Texas, because as many of us know, you know, if you live in Lake Charles and you're looking for abortion care, it's closer to go to Houston than it is to go up to, let's say, Shreveport or come all the way to New Orleans or Baton Rouge. There is a very fluid border, especially on the western side of our state, around people seeking and accessing health care. I know up in Shreveport at Hope Clinic, they see a really strong number of, you know, Texas visitors or Texas patients on any given year. And nowadays, I was on a conversation with Kathleen Pittman, the administrator over there at Hope Clinic last week, and she mentioned that since COVID-19 had really started impacting clinic access, that the number of folks that they saw from Texas has risen to about close to a third of their clients. And so I say all of that to say that when we're talking about what abortion access looks like in Louisiana, we cannot just look at Louisiana. So with that in mind, I think the most important story to tell about what's been happening in the last month and a half or 2 months around abortion access and abortion funds is the story of how the ecosystem of our funds and practical support networks have mobilized quickly. You know, in the moments, truly in the moments after these orders started coming down in Texas and Ohio and other states that were kind of leading the charge on restricting abortion access, or let me be clear, sorry, on using this human and economic and health crisis to foster another crisis in restricting abortion access. As soon as those strategies started coming down the pike, and as soon as those laws started being, orders started being passed, abortion funds mobilized. They, in a matter of days, in the space of a weekend, and I'm really proud to say led by our client and community coordinator, Elizabeth Gelvin, they mobilized to create an entire communication network. Abortion funds across the country recognized very quickly, yeah, thanks Debbie, I think it's really awesome too. Abortion funds across the country created new ways of communicating with each other to share up-to-date resources. They created an Airtable and an entire system to share to-the-minute information about where abortions are currently being provided, what restrictions are occurring at those clinic levels, what restrictions are occurring in terms of like travel. So for example, if you needed to leave Louisiana to go to Texas, what would that look like in crossing the border? Would you need to stay there longer? It has just been truly inspirational to see the way that abortion funds have been leading the way in keeping each other informed and up to date. And I think it's important to emphasize, as I think has been emphasized by many, many other people, this is certainly not an original idea. I think it's important to emphasize that in this moment when we're all really mobilizing nationally around mutual aid and mutual support, it's important to lift up that that is the work of abortion funding. Abortion funds are mutual aid networks, and we have operated that way for a very long time. To be more specific about what this looks like in Louisiana right now, yeah, thanks. Folks, please don't forget to mute your mics. To be more specific about what this looks like in Louisiana right now, I want to kind of share some updates on what the New Orleans Abortion Fund has been doing to pivot our response and to better support people in our community in this moment. So we recognize, and I think everyone on this call probably does too, we recognize that the impacts of COVID-19 are impacting our callers and our clients as profoundly, if not more profoundly, as they are other folks. You know, the people who we serve as an organization are folks who are already living on economic margins, who are already underserved in terms of healthcare access. Many of them don't have health insurance to lose. And if they did, it wouldn't pay for abortion anyway in Louisiana. Many folks in our community that we serve as an organization are people who've had 2 or 3 jobs who've lost all of them now, or maybe lost 2 of the 3, and that's impacting their ability to get unemployment insurance. And I think it's also really important to lift up that the majority of our callers at the New Orleans Abortion Fund are people who already have children. And as many folks I'm sure know, you know, having a child at home right now or having multiple children at home right now complicates everything. If you're privileged to be able to work from home, it makes that harder. If you're not able to work from home, or if you lost a job that didn't involve working from home, it means that your expenses are, you know, piling up. And, you know, while I think it's critical to have abortion access at any time, I think that at this moment, when there are so many economic and human disasters kind of piling on top of each other, it makes the need for bodily autonomy even more profound. And so in recognizing the growing needs of our community and the folks that we serve at the New Orleans Abortion Fund, we pivoted last month into providing practical support funding for the first time in our history, and that's something that we're going to be continuing to grow out. What I mean by practical support funding is you know, from day one, we've always helped pay for your abortion appointment. If we have the funds, if you call us, if we're able to, and if the budget allows, we help people offset the cost of their actual abortion appointment. Practical support funding means that we're now also funding all of the different pieces that help you get to that appointment. based on need. So that includes things like gas money. You know, we know that there are only 3 clinics in the state. Some people have to leave the state. It can be expensive to get your butt to the clinic. And with a 24-hour waiting period, you might have to do that a couple of times. That can really, those costs can really pile up. We're also helping to pay for folks' hotels if they need to go out of state or if they need to travel far from home and stay overnight. We're helping fund childcare because, as I mentioned, so many of our callers are people who already have children at home. And if you need to leave home to go to the clinic, you know, who's going to watch your kids? Those are really profound questions. We're also helping folks pay for food on the road if they do need to hit the road. And so all of these new measures that we're taking around practical support funding, they're responsive to COVID-19, but they're also responsive to the reality of abortion access in Louisiana writ large. You know, something I say a lot is that in many ways we are already an abortion desert in this state. In many ways we already sort of live, you know, beyond Roe. And scaling up to be able to provide practical support in this way is another way that we, as an abortion fund, as a mutual aid support network, are able to help ensure that folks are able to truly, you know, make the choice and have the resources they need to make that choice. I didn't really time myself, so I think I'm going to stop here, and I'm happy to answer any questions at the end or any urgent questions in the chat. And I'll just pass it back over to Michelle. Thank y'all so much for being here today.
I think that we will hear from our next speaker. So Pearl Ricks is the Executive Director of ReJAC, the Reproductive Justice Action Collective, and they are going to talk to us about gender, abortion access, and the work that ReJAC does to provide emergency contraception to
Give
the
me
community.
that phone.
Hear me okay? All right, cool. Hi, everyone. I am Pearl Ricks. Thank you for teeing up the introduction, and thank you to everyone who is here. Before I jump into things, I want to take a collective breath with everyone. You can do it and turn off your camera, whatever, but we're going to breathe in for 4 seconds. We're going to breathe out for 4 seconds and just be for a moment. So let's go. Okay, thank you for doing that with me. It's been such an interesting and hectic time, as we all know. So I'll be talking to y'all about gender, abortion care, but more so emergency contraception and what happens with all of that in the state of emergency. So we all know, well, first I'll start with what ReJAC does, because that's a shorter conversation. So we have a Plan B NOLA program, and that program provides free or by donation emergency contraception around the city. So folks will call our hotline, they'll get in touch with one of our volunteers, and then they work out together how many pills this person needs. If it's someone who's over 165 pounds, they get 2, and then they get our EC packs. And in that pack is emergency contraception, condoms, a pregnancy test for 10 days later, and also a sexual health education zine. To preface that, we have the zine as its own standalone program for sexual health education, and also behind it on the latter end, we have Can I Get an Abortion in Louisiana.com, which is an abortion access website, and it collects all of the live access information from East Texas, Louisiana, and Mississippi. So everything that people have been talking about so far, Stephanie, Michelle, Elizabeth, like all of that is spot on, and it's very much the world that we're sitting in right now. So before all of COVID, we provided these services, and then of course after this we're seeing an uptick. Construction's going on behind me, so just someone let me know if you can't hear me. But we're seeing an uptick in the need that people have, so they're contacting us more. No, 1 second. Thank you. So they're contacting us more, and also it's more difficult to get people what they need. So we're finding that we can't ask people to do face-to-face. We have to switch and adapt our services and move to a mailbox model. The mailbox model then adapted to a harm reduction box model, which is modeled after the Little Free Libraries. So that is how we're shifting our access in the time of COVID to make sure that it's obstacle-free for folks. We're looking at like local and state and national response. And as everyone has been saying, it hasn't been amazing, but something that has been cool in the city is that people are stepping up, and we're seeing providers say, hey, we want to provide EC here and work with you guys. And that's been really helpful. But going into the gender piece, which is something that is more expansive and something I'd like to spend some time in. The first thing that I have to communicate is that, this is Women on Wednesdays, and I don't identify as a woman. Michelle has asked me to come and present a couple of times, and I wanted to make sure we could have the conversation around gender before I popped up and presented. And I wanted to make sure to have that conversation here and talk about how gender, or not acknowledging the full spectrum of it, is actually pulling a detriment to the goals that we're all trying to achieve, and how we're stronger together, better together when we're more inclusive. So though I don't identify as a woman, I hold my womanhood. I'll put it down sometimes. It's been restlessly earned and it's been painfully paid for. So I get to live in it, and I also get to put that down. And what does it look like when we call something women's rights, or when we put out surveys and we're asking to survey women, and what groups of people are we forgetting within that, right? So when we look at women's rights and how it excludes multiple groups, we can look at non-binary folks. So people that don't identify, don't want to respond, and actually could experience psychological impacts or emotional impacts from interacting and being considered a woman. So we miss that in not only our statistics, but in our community surveys and any information when we're looking to really be inclusive of people who can get pregnant. When we're talking about folks that are able to get pregnant, we don't have to say women, because we know not only me standing in front of you or being here right now, but multiple people throughout our communities. It's not just women who get pregnant. So being inclusive and being thoughtful and intentional on how we are speaking about things will not only allow us to reach, more deep in audiences with our communities, but also bring more people to the table and understand how we can help them. And an anecdotal example of that is a friend of mine whose mother works for the Health State Department, and my friend is a trans man. And having that conversation with their family, or with his family, was very difficult, and they found ways to respond, but also his mother decided that, okay, well, we have forms and I can change on the form. Like, what does giving a gender option look like that is outside of male and female? And then how will that inform the decisions that we make? So that small change allowed them to pull in a new community, or a new to them community, and really flush out like, what is the need across gender and across the community? Not only non-binary folks and trans men, but our trans sisters in the struggle. And when we use women's rights, are we really being inclusive of all women? And I find no, like, this is the work that I do. These are the circles that I'm in, and it's still a conversation that we're having. And not only that, sometimes not the right people are having it. So you may know that your organization can be more inclusive with its language, or is clearly excluding people that don't identify as women but can get pregnant, or are touting that you do women's rights work, but you're not thinking about the anti-trans sports bill. You're not considering how a lot of anti-trans legislation is being passed, and how that's also impacting what we are trying to accomplish in terms of abortion access, but really obstacle-free right and access to full spectrum healthcare, and what that looks like. So when we consider combining those forces and we consider bringing everyone to the table and how we can have these conversations across social lines that have been created, what does that look like? How are we working with doulas and midwives and people that want to be pulled into that circle but are excluded typically because they may or may not have breast or a uterus? And what are we thinking is, how are we thinking so traditionally that it prevents us from working together? Something else that is really important that I want to touch on, it's been mentioned a couple times in this call, and it's related, but it shifts, is the multiple visits and what's going on in, Louisiana, and not only the cost behind that, but considering body dysmorphia, right? So what does it look like when you are someone who is pregnant and at the same time, you don't want to continue going to the doctor and have someone messing with your body in a way that makes you feel, that makes you disassociate, that makes you feel unreal, that makes you feel unseen and disrespected. So when we're fighting for this legislation and when we're fighting against legislation and opening access and really wanting people to be seen and felt and held by their community and healthcare system, we're really fighting for a broader group. And it's really important that we pull that in here and that we understand that and that we bring the right people to the table. And when we bring those people to the table, that we sit down. There are moments that I need to sit down and listen. There are moments that we all need to sit down and listen. And I really appreciate having this platform. And I hope that you engage in these conversations in your organizations. When you hear someone say women's rights, you kindly push in on that and see what that conversation can be like, because we know from my friend's mother that it takes one conversation with the right person to change how someone can be seen across the state, to change how they can be seen in their healthcare, how they can be seen as parents, even what is a family. When we look at family wellness, you don't have to be married or living together. You don't have to be a traditional family to be considered in that family and community wellness. And because we're not including those people, our voices aren't amplified as loud. So in that breath, I hope that you take the 4 seconds later and in that imagine all of the people we haven't been talking with, all of the people that haven't been on these calls, and all of the people that haven't been considered in legislative language. And we exhale what it looks like to have them beside us. So thank you.
Thank you so much, Pearl. And again, we'll have time for questions at the end, but if you have a question that you're already thinking of, you can put it in the group chat. I wanted to talk a little bit about how the COVID pandemic is impacting young people that are seeking abortion in Louisiana. So I'm going to actually share my screen again. Louisiana, we do have a law that requires that if you are younger than 18, you need your parents' permission or the permission of your legal guardian to be able to get an abortion. However, there is a process that young people can go through called judicial bypass, in which they can apply to a judge to basically have a waiver of that requirement. And so Lift Louisiana supports the Louisiana Judicial Bypass Project, where we provide free lawyers that help young people navigate through this process. So it's important to understand that obtaining an abortion as a young person has always been challenging in Louisiana, but the stay-at-home orders and other actions that local and state governments have taken in response to the pandemic, which are necessary, in a lot of ways for public health, have actually increased some of the barriers that young people are having to overcome. So one of the things that I wanted to show you, give me just a second to get back to that screen, is this graphic that shows how the judicial bypass process is supposed to work. So you can just sort of see the different steps that the person seeking an abortion has to take. And this includes all of the other regulatory barriers that you would have to go through to obtain an abortion anyway in Louisiana. So now, because the courts are closed, the hearings are being held by video conference, which is great, except that, you know, this requires that our clients now have to access the have access to the technology and the knowledge for how to use it in order to be able to participate in this way. And while our clients no longer have to get to the courthouse, they are facing additional challenges in accessing transportation to be able to get to the clinic, you know, 2 times for the 2 appointments that are required, because buses and the streetcars have limited their services. So our young people now are relying really heavily on support from the New Orleans Abortion Fund to get the money that they need to be able to get to and from their appointments and to pay for their procedure. And, you know, our lawyers are also really being challenged because, and, you know, in addition to providing, you know, the legal aid that that these clients need in order to navigate this process, a lot of what the lawyers are oh, okay, sorry, I'm just reading the chat box that the screen is no longer sharing the graphic. So let me pull that back up for folks. But yeah, so, you know, a lot of what our lawyers do is, you know, really, you know, provide like compassionate sort of emotional support for young people as they're going through this process. And that has become particularly challenging because these interactions are not happening face to face, and so much of the communication and the work of the lawyers, you know, explaining the process and you know, and helping their clients, you know, really deeply understand it and also you know, move comfortably through the process. It's just a lot more challenging when you're having to do that over text messages and phone calls or video conference. But and then in addition to that, because the clients are really needing to access a lot of other you know, other services and resources to navigate through the process, they, you know, our lawyers are really sort of stepping up and playing the additional role of trying to connect the clients to these resources. So, you know, it's been a learning experience, I think, for everyone all around. But we are, you know, you know, grateful that the process can continue and that, you know, everybody along the way has been willing to, you know, to adapt and to make different accommodations. So I think that those are just some of the things that we wanted to share when, you know, we're talking about how different kinds of restrictions and especially some of the, you know, changes that, you know, have occurred in our society are having an impact on people. I think it's really important to think about, you know, young people and how challenging abortion access already is for them. And then, you know, having to really overcome some of these additional barriers has been very challenging.
So I'll introduce Women with a Vision as an organization first and how we came about talking with Representative Landry about this particular bill. So Women with a Vision was formed in 1989 as a harm reduction agency by Black women who saw the need within their community to educate around the issue of HIV and drug use and provide harm reduction equipment to drug users. And through that advocacy and those efforts, we engaged with drug users, of course, and also sex workers at the time. we know that there was a need for not just IV drug use or clean needles and cookers and whatever was provided at that time, but information was necessary as well as condom use. And what we found through our community advocacy and through our interactions with community members was that sex workers were being criminalized, highly criminalized, but also put in harm's way because of the nature of their work and the fact that they didn't have a lot of community support. That brought us to post-Katrina and our No Justice campaign, which we begin to realize because community members came in and talked to our executive director, Deon Haywood, about their inability to access housing because they were on the sexual predator roles. And most of the women that come into our office or people that come into our office are sex workers, and they're in need of services, housing, finances, just overall supportive services. So at post-Katrina, if you are a sexual predator, they put that on your identification. So your driver's license, and think about the myriad of ways in which you have to show identification. If you're going out to have a drink, people will card you. Definitely if you're seeking housing services or job opportunities. And many of the people that were coming into the office were actually no longer sex workers, but they needed housing at the time and was on the rolls. So through our No Justice campaign, we were able to get 800 people off of the rolls, most of them African-American women and trans women off of the sexual predator rolls. But that is not enough, and it was not enough because sex workers continue to be highly criminalized in a myriad of ways. So one way in which police continue to criminalize people engaging in sex work who are doing it solely for the purposes of getting by in life and trying to get resources, and many of them have children and they're taking care of community. So it is a form of caretaking and also sustaining themselves. So what we found is that people were still being criminalized. For instance, trans sex workers fear, or trans women fear carrying condoms for being patrolled by police officers when they carry condoms and profiled as sex workers, and then criminalized thereafter. So then condom use is not being adhered to because of fear of being criminalized. More importantly, and not importantly, it's equal of importance, is that people who engage in sex work are doing it to benefit their ability to eat and sustain themselves and maintain housing. So we had a couple of years ago where sex workers in the clubs, where the clubs were accused of hiding trafficking victims or facilitating trafficking, and the clubs were being raided, and sex workers were out of work and could not pay their rent, and they could not take care of their family members or themselves. Right now, we're in COVID-19. A lot of sex workers cannot work right now. And some of the resources that have gone around via our government restricts funding for sex workers as small businesses, meaning that they cannot get any kind of subsidies. Women with a Vision and other mutual aid groups have facilitated the conversation and making sure that funding and resources get out, such as BEAR, NOLA, and other people who are really in it to make sure that everybody survives through COVID-19. So that is the lay of the land, and it is the reason that we have worked with Mandy Landry for the presentation of HB 366, which is a law that repeals certain prostitution-related charges, and I'll hand it over to Mandy for the information on that bill, and I'll add to the conversation post that.
Okay. Hi, all. Sorry, I'm going to be home in 2 minutes. I thought I was going to be home by the time you got to me. I was running a few errands. So hello, everyone. I'm Mandy Landry. I represent District 91 Uptown. Probably most of you on here may know me. I'm a new member. I come from a heavily Democratic district and I'm probably the most liberal member of the state legislature now. And I just say that to let y'all know that I have a lot more space and personal willingness to cover certain issues and topics than a lot of members. And so I reached out to Women with a Vision, among other groups, earlier this year. I've done a lot of legal work in the repro area, but had not worked directly with Women with a Vision, and just kind of asked them, you know, what issues are important? What would y'all want to look at this year? And they said, let's go for it. Let's start the conversation on decriminalizing sex work. And unfortunately, because of this craziness going on, my optimism is somewhat low that we will have a hearing on this bill. I think all bills, when we go back, will be severely limited to budget issues, but it's still a live bill. 366 is in criminal justice, where Ted James is chair. He had COVID and was hospitalized and was really down in the dumps, but is getting his mojo back, and he is angry about a lot of stuff. So I'm not counting the bill out yet for this year, that he won't hold a hearing on certain bills that are still in criminal justice. But what I can say is that it even with the minimal amount of time that we were there, it did start some conversations. There were some interviews that we had early in the session. People reached out to me, people I'd never spoken to before came to talk to me about it. And that was, you know, when I met with Lakeisha and Christine and others early on, that was kind of our idea, which was that let's start this conversation. For a lot of people in our state, especially in the northern part of the state, decriminalizing sex work is not something they've ever heard of. They probably don't even know the term sex work. These are people who have never met anyone who identifies as trans. I might be the first person they've met who identifies as pro-choice. These conversations are going to take a long time, and just starting them and explaining things, I think, goes a long way. I had some weird comments like, is this part of your female empowerment thing? And, you know, I don't know what to say to that. I mean, at least they kind of knew some of the words. I said, well, you know, this is a sex work at heart as an arm's length transaction between adults, and should be left at that. And so they kind of started to think about it. I think it's also important, in talking to a lot of people in Baton Rouge and other advocates, to very clearly differentiate between trafficking and sex work. They are two totally different things. And unfortunately, in a lot of media and some of the retro world, they conflate the two things. And I think it's super important when talking about it, to make sure people know, you know, trafficking is illegal. That is a crime. That is someone doing something against their will. And sex work is voluntary, is consensual, is all of those things. So I don't know much about what's going to happen this year. We're supposed to go into session on Monday. I don't know if any of y'all have been following the news with the legislature. We're supposed to go in Monday through the end of the month. But right now, some of the Republicans are trying to remove the governor's emergency powers, which gives us like all kind of federal money and guidelines and unemployment, and not state unemployment, but the other one, all kinds of things. And they're trying to remove it because they want all of you and all of us to go back to work early to make money for them, essentially. It's crazy. We're just kind of watching them fight it out. I don't think they will succeed because there's just too much money at stake, but they are certainly pushing it. But if they're fighting this stuff, that's another week that hopefully they won't try to push like tort reform and some of their other nonsense when we get back. The governor's main provisions when we get back are funding and unemployment, and making sure that like public health and some basic functions are funded for this year. And then we may have a special session later in the year. So I don't know if any of the bills that any of us introduced will go far this year, but mine are all live. I requested that they all remain on the schedule for now. So they are still live, and I'm hopeful. But if anyone has any questions about the bill or the craziness going on in Baton Rouge, or Lakeisha, if there's anything I didn't address, please let me know.
Thank you for that. And I thank you for all of your work you have put in already.
It's crazy.
So one of the things that I do want to make sure people know is that a sex work bill that decriminalized sex
Hey, are you guys able to develop disposable cameras, like Instax cameras? Okay. Would I be able to drop that off today?
Maggie, can you mute yourself, please?
Okay.
Hello? So I do want to make clear that this bill does not restrict
Okay, amazing. And
law.
what time do you, like, what is the typical turnaround time for that?
Michelle, can you mute Maggie? There you go.
Okay. Okay, so it doesn't restrict anti-trafficking laws. There are federal laws, there are federal mandates that also are in collaboration with state laws and state mandates. This is specific to decriminalizing sex work. I also feel that we are open to conversations with people who and activists who are fighting to keep people safe via anti-trafficking laws. We can have those conversations. Inherently, I feel like want the same thing, which is safety for people who are engaging in sex work and people who are being compromised through trafficking. We want safety for them as well. So I feel like this can proceed forward and that we can continue to educate the community about what sex work is, and also have voices of sex workers at the table, and making sure that people have the community conversations that is necessary to keep people safe.
I would agree with
Thank
that.
you.
With some of the people I talked to about this, they were receptive, very receptive to the point of view or the angle that decriminalizing sex work would assist in addressing trafficking and addressing crimes against sex workers and public health issues. And when I put it more into those terms, they were very receptive. And the violence that is experienced by a lot of sex workers. So I think that's a great idea and something that should be continued.
So we have a couple questions. So one is from Zoe asking, can you link us to mutual aid funds that are specifically supporting people who are slipping through the cracks of existing government aid during the pandemic? So I think this was directed at Lakeisha and some of what you were talking about at the beginning.
Sure. There are a lot of mutual aid groups online. We also have our sex worker fund that is online, and you can go to Women with a Vision's website. That's www.av-no.org. There is also Bear NOLA. Bear NOLA is the Bourbon Street Alliance for Responsible Entertainers. I believe that's the acronym for BEAR. And so they also offer mutual aid and support to sex workers. I think that they just put up their mutual aid support that they're handing out for sex workers in New Orleans specifically. Our mutual aid support is for sex workers in Louisiana. So we have had people access from Shreveport, Jefferson Parish. We've had a great deal of outside New Orleans sex workers come in and get support. But there's a lot of mutual aids on Facebook that you can, groups that you can connect to, as well as like herbal support and so forth.
Yeah, so we can work to put together a list and send those out to folks when we send the link to the recording and other resources.
Yeah.
Another question that we had is from Mason, who wanted to know if there were efforts at the local level in Orleans Parish to decriminalize sex work via the city charter.
So we have worked with Mayor Cantrell's office on legislation that basically expands the Good Samaritan law that says that sex workers will not be criminalized if they have to report violence on themselves or violence against another community members. That's in the hands of the Department of Justice right now. That was our initial conversation. And then when Mandy came on and was like, how can I help? We were like, well, if we can make it a state decrim bill, that would be phenomenal, because that would extend more of coverage for people statewide.
Okay, great. We have a question for Mandy. If this year basically just becomes another fiscal year, is the legislature considering shifting the rules for next year's session to include more bills that outside of what the typical fiscal session allows?
I don't know if we can. I think, this is something I'll have to ask on our call later today. I think the delineation of fiscal versus non-fiscal years is constitutional. I'm not sure on that. My gut tells me no, because a lot of this stuff is kind of set in stone and difficult to change. But let me find out on that, and I can get back to you. A lot of the procedural stuff is extraordinarily difficult. Like, even though we voted on that random election proposal by email and fax, it's because that wasn't actually legislation. That was a proposal from the Secretary of State, and we just had to give it an up or down vote. But for actual legislation, it's somewhere in the state constitution or in a few different places that we can't vote remote or by phone. So that's kind of been part of the problem with getting us back, or maybe that's a good thing, getting us back together. I think the description of if a year is fiscal or not might be in there too, but I'll let you know, Stephanie.
Great. Chantrell has a question, I think for Lakeisha. Is the statewide coalition on human trafficking involved with Women with a Vision or effective in the work that you're doing? And then another part of that question is, do you have any information about Lafayette? Because the I-10 corridor is a big trafficking area.
Okay, so again, a lot of trafficking organizations have been hesitant to work with us because they perceive that their work deviates substantially to the work that we're doing. And we don't want to work with others who will further endanger sex workers through continuing laws like FOSTA SESTA that has put more people that are engaging in sex work in harm's way by making it illegal to kind of screen clients online and just imply a heavy burden on the sex workers and pushing them further back to the margins and on the street. So with that being said, a lot of anti-trafficking people have not want to work with us because we do uphold sex work as work and the protection of sex workers. However, I would be willing to have the conversation with anti-traffickers to see where our work meets. Finally, we need to have those critical conversations where our work meets. And I believe that our work meets in making sure that everybody is safe. People who are engaged in sex work are safe and have consented to that and can actually do their work in peace without being criminalized. And people who have been coerced into sex work, into sexual activity, can also be protected and safe.
Thank you. I think at this point, I want to introduce our final presenter for today. Louisa Tanhauser from the Center for Reproductive Rights is going to talk to us about the much anticipated upcoming decision from the Supreme Court in the June medical case, which is about Louisiana's admitting privileges law. So Louisa, take it away.
All right, I'm going to share my screen and cross my fingers for no technical difficulties. Here you go. All right, so I'm going to just provide a quick update and a really fast refresher on June Medical Services v. Russo, the law that I bet almost everyone, or if not everyone on this call already knows is a challenge to Louisiana's admitting privileges requirement. The law that is being challenged in this case singles out abortion providers and requires them to have admitting privileges at a hospital near the clinic where they provide abortion care. And admitting privileges are both medically unnecessary for the safe provision of abortion care and extremely difficult, if not impossible, for abortion providers to get. So this law was designed to shut down abortion clinics, and if allowed to take effect, it would decimate abortion access in Louisiana. And it's also virtually identical to a Texas law that the Supreme Court struck down just 4 years ago in the case Women's Health versus Hellerstedt. So back in early March, which feels like a lifetime ago, the Supreme Court heard oral arguments in June Medical. I'm just gonna make sure that I see a chat thing coming up. I just wanna make sure it's not a technical difficulty anyone is having. Oh, we're fine, sorry about that. Excuse me. All right, so they heard oral arguments on March 4th. They're expected to issue a decision before the end of this June. But of course, these are pretty extraordinary times, and many things about the court's usual process and schedule look different right now due to the pandemic. So the current crisis could affect the timing of a decision in this case in ways that we can't really predict. We could get a decision earlier, possibly as early as next week, but it still is likely that we will get one in June. And we will, of course, keep everyone posted, which leads me to decision day. And I just want to flag that if you're interested in keeping up to date on this case and hearing about it as soon as we do have a decision, we have an email update list that is just for updates and resources and advocacy around June Medical Services v. Russo. And you can sign up for it at this link, which I'll also drop in the chat box after. We will let this list know and all of our partners know as soon as a decision comes down from the Supreme Court. And we're also working closely with our Louisiana partners, including Lyft and Wave, and like special shout out to Michelle and Lakeisha for all of their planning and work on this, to put together some opportunities for folks to join together virtually on decision day, whenever that may be, since sadly we won't be able to physically be together like we were outside the court on oral argument day. But we have some fun things in the works, and we will have digital advocacy tools that that people can use to plug in, and all of that we'll share information about over this litigation list. So that's one good way to make sure you get that information as soon as it's available. So that's really all from me. If folks have questions, please let me know, but I'm gonna stop sharing my screen. I'll drop that sign up link for the email list into the chat box, and let me know if you have any questions.
All right, thank you so much, Louisa. So we do have about 20 minutes left for the time that we've allotted for this meeting. So if folks do have other questions, you can either unmute yourself by pressing *6 or clicking the phone icon on your computer. Okay, I see from Pearl that they would like to address the question that Vivian asked earlier. So yes, please.
Okay, cool. And I'm gonna share my screen. I'm just making sure we still have Vivian. But either way, just in case this will be helpful for other folks. So let's see. Let me know if I'm doing this right. And if y'all can see it.
Not yet.
Not yet, okay. You know what, it may not let me. Yeah, let's see what happens, because this is really important to me. Okay, here we go. Can you see it now?
Yes.
Okay, cool. So Vivian had asked about the, how is it that it's not only women who get pregnant? So I wanted to take this moment to explain not only that, but you know, some other elements of sexual identity, all that kind of stuff. So right here, I'm sharing what is the genderbread person. This particular version is created by, it's pronounced metrosexual.com, and they are a website that is like really good at having digestible information on like gender, on sexuality, so forth and so on. So I wanted to break down gender identity. So gender identity is what I consider myself to be as an individual, how I define my gender based upon how much I align or don't align with what I understand to be the two options we have socially for gender. So the two options we have are women and men. So because of those two options that I was given in my, you know, in my growing up, my gender identity is based off of those spectrums. I hold it differently, but that is something that is more like cognitive. When we look at gender expression is like the way that someone dresses, the way that they may act, like certain actions are seen as more feminine socially or seen as more masculine socially. So because of that social context that we're given, like this is what all that is built off of. So how things are perceived, like working on cars is typically perceived to be more masculine. And if you're a woman who works on cars, then like, what do you think, you're a man? So like keeping like that as like context and as background noise to understanding this. So you have gender expression, and that also falls on a spectrum depending on who that person is. So we can see androgyny in that. We can see folks that are say like, you know, my gender identity is a man, but I like dressing in what people consider to be feminine clothes because it makes me feel pretty. So that's an example of your gender expression. Now, your biological sex or your assigned sex is what someone chose for you when you were born. And it's really important to understand that, not only because like having that sex assigned to you changes the way that society treats you, but also that there are people that like maybe intersex, where their parents just pick one, you know? So like looking at both of those things as mutually exclusive and still yet like very equally important. So when we look at biological sex, you're usually assigned to be a male or a female, a woman or a man, and society wants to treat you in a certain way. You have the pink instead of the blue when you leave the hospital. Everybody, you know, the whole gender reveal thing, and that's biological sex. So when I go to the doctor, I understand that like when I check off woman, I'm doing that for my biological sex, not how I identify in my gender, and not how I speak about myself, and not how I like myself to be written about. And then for the part of like attraction, just to pull it all together, because it's on here, there's being sexually attracted, romantically attracted, and then how that falls on a spectrum, you know, dependent upon like where you lie in gender identity. So it is a lot of information. I'm not going to pretend like everybody is supposed to hop off of this call and be like, oh, I get it now, let me go and teach a class, right? Like that's not what I think is gonna happen. But what I'm hoping is that like, just like Vivian did, like people are asking questions in like a space that was created for it in a respectful way, in a form of like respectful curiosity. And also if you wanna spend more time with this, it's pronounced metrosexual.com. Everything that is there is like helpful towards sexuality, gender, and everything like that. I don't use all of the tools just because I don't feel like it's necessary, but this is something I share with everyone and they start to understand it. So please spend time with this in a respectful manner, and share it if you need, or check in, you know, with people in your life and say, hey, will you look over this with me? Because I want to make sure I'm understanding this in a respectful way.
Pearl, thank you so much. And we'll include a link to that resource in the follow-up email. Thank you.
Sure.
That's a great visual.
We have a question.
Oh, yeah, I was going to ask about the, Lakeisha, is there a way to donate, or are you encouraging donations specifically to the Sex Worker Relief Fund, or are the donations just to go to Women with a Vision and you all will, you know, replenish the fund as you can?
So you can donate to Women with a Vision and add Sex Worker Fund in the description, and that will go directly to the fund. We have our initial funding from various sources that uphold sex work. Different emergency funds that we petitioned and wrote in grants for, gave us the funding for our first wave. And then there are a couple of organizations that are holding some fundraisers to keep replenishing the funds as necessary. So donate, use the donate button on our website, and just in the description, you can put Sex Worker Fund.
Thank you. And I did include the link in the chat, but we'll also be sending that out with the notes. Marjorie has a question for Louisa, well, probably Louisa or Elizabeth. The question is, in light of the recent Ramos decision on Louisiana unanimous juries, do you have any thoughts on how the conservative justices on the court may handle stare decisis in the June medical case?
So this is Elizabeth. I'll take a stab at responding. I think it's really important to remember in June medical that the issue is abortion access, that Roe and abortion rights are not part of this case. But yes, Marjorie, to your point, I think, you know, Justice Kavanaugh outlined his approach for how the court should approach stare decisis in the Ramos decision. But again, we have very strong precedent on our side in June medical, and the strongest is obviously Whole Woman's Health, which was only decided 4 years ago. So our argument in June medical is that precedent should be followed. And even if we take Justice Kavanaugh's test kind of at face value, abortion rights, in our opinion, doesn't pass the test that he outlined. So hopefully that is helpful.
Elizabeth, can you explain for the non-lawyers on the phone what stare decisis is?
Absolutely. So stare decisis essentially is the idea that once something, has been in law for a long time, that you don't just go back and change it, right? That there has to be a really good rationale for doing that. So in terms of the Ramos case, the decision that was overturned by Ramos was a decision from 1972. So that had, been longstanding precedent. So in order to go back and overturn it, there essentially has to be a really good reason to do so. It can't just be, the whim of the court. So stare decisis is essentially respect for longstanding Supreme Court precedent.
Thank you so much. Do folks have other questions? And again, you can unmute yourself by pressing *6 on your phone or the little phone icon on your computer. Zoe's question is, does this happen every Wednesday? Super informative and helpful information, which is great, thank you. So we are not doing them every Wednesday. Our next one, and I'll actually pull this up because our next one is scheduled for May 13th. It'll be also at noon, and I will drop the link for how you can register for it in the chat box, and we will also send that out with the notes. I'm still working on finalizing the topic and the speakers for that one, but we will probably have more information about that early next week. And we're basically doing these every other week. We started these actually last year, and we were holding them as actual advocacy days at the Capitol, but obviously we're not at the Capitol, and so we are sort of adjusting our our platform at this point.
This is Julie. I wanted, if you don't mind, we aren't at the Capitol, although the leadership is trying to pull people back to the Capitol, at least pull the legislators back, and there is a great concern because of the disproportionate burden on the minority community of sickness and death from COVID. It's really a heart-wrenching kind of a thing. Even Mississippi, their legislature is not meeting for another 2 weeks. So part of this is an education opportunity that's really great because it's reaching more people than had turned out physically in Baton Rouge, but learning to develop a dialogue and relationship with your legislators if they're supportive so that you can be supportive with them, if they're not supportive so that you can constantly let them know what you think, is very, very important. And identifying friends and allies and others outside of the friendly and supportive legislators in Orleans and a few, here and there in the state, they're not enough. We really have to push that envelope. So, for example, the leadership is one is from, the river parishes, and one is from Lafayette. The more people we can find to get on these kinds of calls from areas outside of New Orleans, the better, so that they can learn about the issues and how to talk about them to their legislators. And then when we get to more specific, what are they going to be doing and when are they going to be doing it, we're going to need to get people really engaged with those legislators.
Thank you, Julie. I put a link to where you can go to find out who your legislators are. You just need to put your address in there, and it'll take you to a site that has links to your state senators, representatives, and your U.S. congressperson and U.S. senators. So you can find out how to contact them and keep in touch with them. And I think if there are no other questions, then we will adjourn. I really want to thank all of the speakers today and everybody who joined and asked some really fantastic questions. We have a lot of information to send you. So please look for an email from me, Michelle, at Lift Louisiana, probably tomorrow. And again, we'll have the recording of this call if you would like to share it with folks in your network that weren't able to join. So thanks again, and we hope to see you on the next Women on Wednesday on May 13th.
Hey, Michelle, I just want to jump in real quick. I've had what I showed you all, I've had saved for so long. When I looked for the website, that is actually not the website I'm going to send out. That has been co-opted by a cishet white dude and is now hosted his website as his own illustration. So I'm going to do some digging because I think his SEO has actually buried the originators of that document, but I'm going to dig for that, and I will send you either an original link or something that we can share so we don't add to any money that he's making off of this by using his website.
Wonderful.
So yeah,
wonderful.
I just help that and let you know.
Thank you. Oh, I did want to say before we jump off that the New Orleans Abortion Fund tomorrow night has a digital, I think it's a dance-a-thon. Is that what it is, Stephanie?
Thank you for pitching my own fundraiser. I think that really speaks to the power of this coalition, y'all. So tomorrow night, as many of you might know, because I know a lot of y'all have been involved with our work prior to this moment, every year the New Orleans Abortion Fund is part of the National Network of Abortion Funds series. We do an a-thon fundraiser. So last year it was a bowl-a-thon. In the past it's been a game-a-thon. And this year we were planning to do a dance-a-thon, and then as we all started social distancing, we realized we could still do a dance-a-thon. We could do a digital dance-a-thon. So it's called the Digital Get Down. For those of y'all around my generation, you might recognize that as an NSYNC song. It is a silly joke, but it's a dance party. It is truly going to be a really fun and special space. It's hosted by DJ Ann Glaviano, who DJs the Heatwave dance party around town. So she does like 60s and 70s soul and dance music. And anyone who either signs up as an individual fundraiser or donates $25 or more to one of the various people who are have a fundraising page up will get a ticket to the event. The event's tomorrow night. I think it's from 6:30 to 8:30. I should double check that. Yes, 6:30 to 8:30. And it's just going to be like a dance party. There's going to be prizes for costumes and things like that. We just are trying to create some spaces for all of us to let loose and build power and fund abortions in our state. And as always, all of the individual donations and individual funds raised go directly to funding abortion in the state. You can find out more about that, probably the easiest place. Oh, thank you for dropping that link, Michelle. There's a link in the chat. You can also always check out our Facebook page. Truly, like the power of coalition work, y'all. Thank you, Michelle.
Michelle is on it, boy.
Also, before we get off, these glasses, this is a look, and I love it.
You like it?
Yeah. To be called out on the full group.
All right, wonderful.
Yeah, I've been in. Can I just say too, Lakeisha, I've been admiring them this entire webinar. They are amazing.
Yeah, yeah.
Thanks,
y'all.
y'all.
The chat box about it, and I didn't want to interrupt your very, very beautiful talk.
All right, well, we will continue this Love Fest offline. I do appreciate, again, everybody's participation, and yeah, I'm just proud to know all of you. So thank you very much, and we will see you on the next one.